Okay, guys, it's 7th of May, and I'm just getting out another quick update on the current situation. Quite a lot of demand out there for it, it does appear, and understandable. So, again, just data and science, and today we'll focus on a couple of recent articles that came out in the last day or two. So, one of the key ones is, as I'm showing now, from Business Insider. And it's the head of Sweden's no lockdown coronavirus plan said the country's heavy death toll came as a surprise. And it's a little misleading actually because the person in question made it very clear during the interview that it was the death toll from the care homes and elderly, particularly, that caught them by surprise. They believed they'd be able to protect those guys by kind of ring fencing the homes. But as we see all around the world, particularly in Ireland where I am, but everywhere, no one managed at all to protect the care homes significantly. So that's just a clarification. But the article, anyway, there's an interview in the article, video interview, which I'll show shortly, and it gives the perspective of what they're doing and why. And I think people should find that very interesting because there's a lot of hype in the headlines and articles. So it's good to hear direct from the people who are leading this challenge as to why they're doing it and how it's going. So I'll show again, just to remind people, the demographic most at risk, which is what we should be really thinking of. And this is Boston data because it's particularly clear and well presented in their government website. But you see, of course, average age very high, like other countries, same as Ireland and elsewhere, and a huge disproportionate bias towards elderly and older people. And that's in line with other similar diseases in the past. So we'll show now Sweden, and you can see in green there in the middle of the graph. And as I explained in a previous update, Finland and Norway are geographically and for many other reasons a less good compare. So I just picked the main countries of Europe from top down to low end, Austria, and you can see Sweden is there pretty much in the middle of the pack. Interestingly, also, it's right beside Ireland, and Sweden actually, Stockholm is driving around 55% of the figures. And Dublin in Ireland is very similar density of people, population, and similar death rates, even though Dublin has been under a very severe lockdown relatively. So there are interesting controls and compares here to keep in mind. So showing the Sweden figures, we see that with a rolling 7-day average, there certainly appear to be coming down, just like the other compare countries. And Denmark is a good compare in fairness, right beside Sweden's main population centres down south. So yes, certainly Denmark has done quite a lot better. So, but anyway, that's the shape of the trends at the moment up to 7th of May. And the turning or bending the curve, again, it's worth checking in on. Sweden similar to Ireland, and the curves tending to behave similarly for most countries, if not nearly all countries at this stage. So a particular bit of good news is, just to clarify, the lockdowns and distancing, even for that matter, when they came out back in March, there was a very clear strategy that was very clearly communicated to everyone, and it made absolute sense. And that was to slow or flatten the curve in order to ensure that hospitals and intensive care units would not be overloaded, in which case, people would not get appropriate care. So that was the reason for this. It has morphed somewhat in the recent weeks, and it seems to be to try and defeat the virus or eradicate the virus. So they're very big changes to the rhetoric that happened during the past few weeks. But again, just to ground us, the reason for distancing and lockdowns was to protect the hospitals. And I think the great news is that that has, generally speaking, except for hotspots like New York that had super spreaders and subwaves and very high rates very fast, and some other countries, generally it's been very successful. So I'm just showing on the screen now Sweden's intensive care unit kind of loading. And as you can see, they actually peaked around April 1st to April 8th. So that's really heartening, and it's great to see that their ICU loading is falling since then. and seems to be heading on down in a good trajectory. And of course, that will in a couple of weeks reflect in the hopefully greatly falling death rates. So just for reference, their capacity is probably up somewhere near the top of the page there, because they had extended their capacity greatly in expectation of an even bigger problem. And luckily, they were able to keep well under capacity and trending down. So with that, just before I go to the video of Sweden's epidemiology leader who's kind of driving their strategy and managing it, I'll just mention again, we want to keep the updates coming, podcasts with guests, all the material. Please help us by sharing extratime.com. And as I always say, this will pass, and the massive death burden and suffering in the Western world is heart disease primarily, and then Alzheimer's, cancers, all connected greatly to insulin resistance, which interestingly, insulin resistance and leptin resistance and inflammatory problems have been shown to be an enormous risk factor for this current issue also. So keep that in mind. Anyway, Extra Time movie, you'll get to see how to assess, address, and stop the progression of a heart disease, the world's biggest killer. So thanks for that.
Dr. Tegnell, thank you so much for joining us on the Daily Social Distancing Show. You are chatting to us from a train station right now, is that correct?
Yeah, that's correct. Train station in Stockholm, Sweden.
Okay. Are you commuting? Are you still out and about?
Yes, I'm commuting from my home, which is in Linköping, a town some 200 kilometers to the south.
Okay. Sweden is an interesting outlier in the world, where most countries in the world have decided to completely lock everything down, keep people indoors, and shut down the country. Sweden has gone for a different approach. Sweden has decided to keep the country fairly open, but require citizens to social distance themselves, to remain responsible, to limit gatherings to below 50 people. And I think, like older people are meant to stay at home, etc. Tell me about what Sweden is doing, and then would you mind explaining to me how Sweden came to that decision to do it differently to everyone else in the world?
No, but I think you have made a fair description. Instead of closing it down completely, we have tried to look at different situations where we know that the spread is most dangerous, like in restaurants. And then we have regulated saying restaurants, you have to see to it that you're not crowded. You can no longer serve in bars, so people sit very close together for a long time. You need to have a social distance between people, so 1.5, 2 meters between people sitting down, and all of those kind of things. We put a lot of responsibility on the restaurant owners. Another one is that we have told everybody to stay home if they feel ill in the morning, even if only slightly ill, stay at home. And and financially that's being okay, since nowadays you get paid even if you stay home when you're sick from the very first day, which the government changed very quickly. So there is a great incentive of staying home if you feel slightly ill. And we have done a lot of things to limit the social contacts among the elderly, giving advice to them to stay home and stuff like that. So instead of saying close down the whole society, we have looked at society and closed down the aspects of society where we think and we know from other diseases and from what we've seen in other countries, most of the disease spread is done. And I think that has had a great effect in many ways. It has enabled our health system to keep on functioning. It has had other interesting effects, like over Easter, Swedish people travel a lot. Only 10% of the normal travels were done, which is a lot of change. Our yearly epidemic of flu suddenly stopped when we instituted these measures in the middle of the normal wave.
Right.
So in that way, it's worked, and we have used sort of what we normally use in Sweden when it comes to public health, and that's really telling people to take responsibility and and sort of do the things they think will fit them the best in diminishing the threat to spread the disease to other people. And I think that's historically worked very well.
Tell me about what's happening in Sweden. What have you seen from the numbers in and around the coronavirus? Do you think Sweden has it under control? Do you think Sweden has seen the worst of it?
I think in Sweden, like in many countries, it's different in different parts of Sweden, even if it's a small country. I mean, Stockholm and the surrounding areas, which is about half the population of Sweden, slightly less, we have had quite a big number of people being ill in the last 2 months. Mm-hmm. While many other parts of Sweden, including the big cities on the west coast and in the south, have had not very many cases at all so far. But in Stockholm and the surrounding area, we have had a fair amount of cases. We think we are up to about a quarter of the population who has been infected so far. That has been done in a fairly slow manner. So the number of cases have been fairly constant for at least 1 month by now, which means that the healthcare who has transitioned a lot, changed a lot. They do very different things today than what they used to do. But they have been kept on working, and they have always been beds free. Everybody in Sweden who needs a hospital bed have gotten a hospital bed for COVID-19 or for other diseases, so it's kept on working. And intensive care has even had at least 20% of the beds free at any given time. So in that respect, the strategy has been successful. We managed to keep the level of spread on a level below the threshold of the health system, which I think is one very important part in any kind of strategy.
People look at the numbers of countries around Sweden and they go, their death rates is far lower in terms of coronavirus. Sweden's numbers are higher. But then if you look at other countries like Italy and Spain, etc., they have higher numbers than Sweden. So when you say Sweden is successful, how do you measure that success? Are you just looking at the numbers of death, or are you looking at it holistically? What does that mean, Sweden is successful?
I think we're trying to look at it holistically, and I'm not saying we were successful in all different ways. I mean, our death toll is really something we worry a lot about, and it's very much related to our elderly people's homes, who have proven to be extremely susceptible to this disease. And we know that there's a number of things quality-wise that needs to be addressed in those, and we are addressing them with a lot of other agencies involved, and we're seeing some improvements. But our death toll has very much to do with that. In other aspects, it's many of the things have worked, I think, reasonably well. And I think the good thing is that we've been able to keep schools open. Keeping schools open is very important for children and children's health. We know that for sure. We have been able to keep a lot of people working. And we know that losing your work is very dangerous to your health. So we've been trying to take a slightly more holistic approach to this than maybe some other countries have done.
There have been reports coming out saying that there will be herd immunity achieved, I think in Stockholm at least, over the coming weeks. What does herd immunity mean for you? And what are you hoping herd immunity will achieve for Sweden?
I think complete herd immunity, we're not sure any country will ever achieve, because that means that the disease goes away, and I don't really see this disease going away. But even some immunity in the population, like the 20-25% that we are reaching now, will have a great effect on the speed of spread. So with that and the measures we have in place, and with immunity going up, I think there is a possibility that we can ease down on some of the restrictions otherwise that we have, so that we, by the immunity level of the population, can have such a slow spread of the disease that the society can start work more or less normally again. I mean, some parts of it will always be at risk. I mean, elderly people will most likely always be at risk for this kind of disease and so on. But many things we can then ease up a bit on.
If somebody said to you, Dr. Tegnell, you know, your numbers, we understand your methodology, we understand everything you're trying to do, but having tripled the death rates of countries like Norway and Denmark means that, you know, you've put some lives above other lives. Do you think that that's a decision epidemiologists / governments need to make? Is it an easy decision to make? Because I don't think anybody has the right answer in this regard, but I'd like to know, like, how you and your team got to that place where you said, you know what, it's worth the risk. We want kids to be in schools, we want people to still be working, and we understand that might lead us to have a higher death toll initially.
No, I don't think, we never really calculated with a higher death toll initially. I must say that's not right. I mean, we calculated on more people being sick, but the death toll really came as a surprise to us. We really thought that our elderly homes would be much better at keeping the disease outside of them than they actually been in here. Not that Sweden is the only country with this problem. I mean, many countries in Europe have the problem with elderly homes. So obviously, it's very difficult to keep the disease away from there. And even if we're doing our best, it's obviously not enough. We are not putting anybody's life above everybody else's lives. That's not the way we are working. We are really trying to keep public health as good as possible in this troublesome time.
That's really interesting, because that's not how it's being reported in many places. I'm glad you said that. It's interesting to hear it from somebody in Sweden who's part of this directly. because Sweden is doing something differently, because populations around the world are getting agitated, because people are growing in unrest, there's protests, people feel they want to go back outside, they want to work, etc., etc., etc. People are now using Sweden as the example. If somebody said to you, Dr. Tegnell, people want to take Sweden's model and apply it to a country like America, would you have an opinion on that?
Not really. I mean, I'm sure there are some things from Sweden that can be transferred to other countries and some things are not. I think some things will become increasingly clear. We are feeling more and more confident about closing schools. It's not something that's really going to be very effective for this kind of disease. It doesn't seem to be very much of a motor. Schools doesn't seem to be very much of a motor of this epidemic like it is in flu epidemics and so on. So some things definitely. Building up the trust between the agency and the population that we have in Sweden is something that takes a long time.
Right.
The trust level has always been high. Now it's increasing. We're up to 70-80% of the population thinks we are doing a great job. Only like 5-10% doubt that what we're doing. And we're even finding that people have better and better adherence to our guidance. I mean, more and more people are keeping social distance and these kind of things, which is actually the opposite of what you see in other countries where people are revolting against it. Here we see that people are more and more in line with what we want them to do.
Right. Well, Doctor, thank you very much for your time. I hope you catch that train, and good luck with the rest of your fights against the virus.
Good luck to you.
Okay, well, hope you appreciated hearing there direct from the leadership around what they're doing and why, putting things in a little context perhaps. And it's also important to stress that as we come out of this, and a dozen countries around Europe now are releasing lockdowns in various stages, Israel actually has incredibly dropped back from its severe lockdown. And the Prime Minister even saying to kids can go visit their grandparents, and restrictions on travel are completely opened up and businesses opening. So very interesting that lockdowns are being taken away so rapidly while the virus is still clearly present in the population. And it will be very important to analyse the data and connect the lockdown point to how much the spread rate or the R0 or RT changed, and use science to actually understand what measures gave the biggest bang for the buck. Because currently there's a lot of talk about lockdowns versus just distancing, and they're not really scientific. They're more associational or belief-based or expectation-based. So we really need the analysis to look at what actually scientifically happened for various measures taken, so we can know that for the future. So again, I'll just close with asking if you could go to extratimemovie.com and stream download our, what I think is a fantastic new movie explaining how to stop the progression of heart disease after you've discovered the extent to which you have it. And if you could share that site, that would really help us too, and recommend the movie. We put a lot into making it. And if so, I'll keep these updates, podcasts, guests, technical discussions, and a lot more. I'll be able to keep them coming. Thank you. Thanks for tuning in, guys. If you're watching on YouTube, you can see my subscribe button in the middle of the screen, and go to extratimemovie.com to see our fascinating new documentary on stopping and reversing heart disease.